keep going.
Go ahead.
Hi, Mr. Smith. My name is
Hello.
Olivia. I'm going to be your student nurse today.
Nice to meet you.
Can you verify your name and date of birth for me?
My name is.
Good job. Okay. All right, so those are all the questions I have for you right now. And now I'm going to move on to the physical part of the examination. So first, I'm just going to look at your face and it's symmetrical, so that's good. Next, I want you to look at my pen light and keep looking at it and follow it. Very good. And now I'm going to turn it on and I'm going to shut it in your eye. Just tuck in for your pupil. Okay, and then can you open your mouth up and say after me, please?
After me.
After me. Thank you. Okay, and then can you just lay down? I'm just going to look at your neck, okay? So you turn your head just a little bit that way. Just looking for your vein distension. And then this way for me, please. All right, you can sit back up. Now I'm just going to take a look at your upper extremities. I'm going to feel your temperature, both hands. And check your skin turner.
What does that do?
Just looking for like how hydrated you are.
Hydration.
Like that. I'm just going to take a look at your nails. Okay, and then I'm going to check your capillary refill. Very good. And then can you squeeze my 2 fingers? Thank you. All right. Next, I'm going to move on to like your respiratory and cardiac stuff. So I'm just going to look on the side, look for any barrel chesting. No? Not labored breathing? You having a hard time breathing at all?
I have a little cough.
A little bit of a cough? Okay.
It's more allergy related, I think.
Just also going to palpate your chest a little bit, okay?
Mm-hmm.
Any pain at all?
No.
All right. Now I'm just going to take a listen. Okay. First, I'm going to listen to your lungs. So each time I put my stethoscope on your chest, you take a big breath in for me and then breathe out. Okay.
So I breathe on you.
Again. And again. One more each side. Doing okay? Getting a little lightheaded? All right, now I'm just going to listen to your heart. I'm going to switch it over and use the bell now. Just go through your heart one more time.
Doesn't matter if I breathe or not.
Okay. You can breathe, you're okay. All right, now I'm just going to listen to your lungs on your backside. So if you mind just facing that way. And then once again, each time I put my stethoscope down, you take a deep breath in and then out for me.
Sure.
And last time. All right. Then you can face back this way. Next, I'm going to check your abdomen. When was your last bowel movement?
About noon today.
Today, and then have you been passing gas today?
Not that I know of.
Yeah, we all do it, so it's okay. So I'm going to lean back from me, please. First, I'm just going to listen. I'm going to be listening for vowel sounds. And then I'm just going to be listening for bruise.
What?
Bruise. I'm just going to be listening for some like blood swishing. Okay. And then have you noticed any tender areas on your stomach?
No.
No. All right, now I'm just going to palpate, okay? Any tenderness?
No.
No?
Tickly.
Good. Okay. All right, you can sit back up. All right, next, I'm just going to look at your lower extremities, okay? So I'm going to be looking on both legs for any swelling or edema. Have you been noticing any changes in color or swelling around your ankles?
Show the legs.
Any changes in color?
No.
All right, and then I'm just going to feel your pulses. I'm going to have you kind of face me, and I want you to push your feet on my hands.
At the same time?
Yes. Like you're pushing on the gas. Push down. All right, thank you. And then I want you to lift your feet back up for me. Sorry, it's kind of hard. And then push up against my hands. Thank you. All right, and then last thing is I'm just going to check your reflexes on your knees. I'm just gonna have you sit. Usually I'd have you be sitting higher
Dangling.
and so your feet would be dangling, but okay. Just gonna try.
You get a plan? All right, Mr. Smith, you can sit back down. That's all I have for you right now. I'm gonna go talk to the doctor, and then hopefully we can help you get feeling better, okay? Great, thank you.
It's nice to meet you.
Nice to meet you.
Hi, my name's Olivia. I'm gonna be your student nurse today. Can you tell me your name and your birthday for me?
Autumn Nakbar, 12/15/99.
All right, Autumn, so I am going to be doing a neuro assessment on you. And so I'm gonna first be testing like your senses, and then I'm gonna look at some of your motor movements and then your reflexes, okay?
Okay.
But first, I'm gonna start off with some questions. Have you been having any headaches recently?
Yeah, a little bit.
A little bit. Can you tell me kind of like what during the day, if there's a specific time or specific location on your head?
Towards the front, maybe towards my nose area.
Okay. And then have you been noticing any blurred vision or changes in vision lately?
No, not really.
No? Okay. And then have you been noticing any joint pain or stiffness or any change in your muscle strength?
I don't think so.
No? Okay. And then can you, this is kind of weird questions, but we ask everybody, it's just a formality, but can you tell me your name?
Autumn.
Can you tell me where you are right now?
In the doctor's office.
And then can you tell me like a generalized time and date for right now?
September 24th.
Okay. I'm gonna look at the Glasgow scale coma scale right now. And so when I first started talking to you, your eyes open spontaneously, so you get a 4 for that. And then when I just asked you these questions, you were oriented and you weren't confused, so then you get a 5 for that. And then can you rotate your feet and move your feet for me? And then can you squeeze my fingers for me? And so you're gonna get a 6 for motor, because you were able to do all of those. And so then now I'm going to move into the senses and the motor check now. So first, do you mind taking off your glasses for me?
Sure.
First, I'm going to take a peek at your eyes. I'm looking to see that your eyes are the same, your pupils are the same shape and size, and then when I shine a light in them, that they dilate and constrict. Okay. Okay. And so then next thing, I'm going to have you keep your head straight, and then you're going to follow my finger, all right?
Mm-hmm.
Thank you very much. Okay, and then the next thing I'm going to have you do is I'm going to have you blink for me, and then I want you to clench your teeth.
Right.
And then make like an angry face for your brow, and then make it like a shocked face and raise it up. All right, thank you very much. Okay, and then the next I'm gonna do is test your senses. So what I'm gonna do, or your sensations and how you can feel it. So I've got this pencil here. I'm gonna use this sharp side for sharp and this eraser side for like the soft. And I'm gonna have you close your eyes, and I'm gonna do it one on each side of your face, and then on both arms, and then on both legs. And then
Okay.
I'm gonna have you tell me if it was sharp or if it was soft, okay?
Okay.
Ready?
Mm-hmm.
This is kind of what it feels like when your eyes are closed. Good?
Mm-hmm.
Alright. Which one was that?
Sharp.
And which one was that?
Soft.
Take your arm now. Do you know which one was that?
Sharp.
What about this one?
Sharp.
And then this one?
Soft.
And through your pants, sorry about that. And then what about this one?
Sharp.
Sharp. Okay. Now I'm going to have you stand up for me. I'm going to test your coordination. So what you're going to do is you're going to have your eyes closed and have your arms standing out straight. And then one at a time, I'm going to have you take your finger and then touch your nose and then bring it back out. And then you're going to do the other arm and touch your nose and then bring it back out.
Okay.
Okay, ready?
Mm-hmm.
And other side. And one more time. Other side. And then one more time for me. And then other side. All right, thank you. Now, will you please bring your hands out, kind of like you're a zombie walker, and close your eyes, and then just watch it. All right, very good. Now I'm gonna put my hands on your shoulders. Sorry, I'm reaching over. And then will you lift your shoulders up and down? Back down, up one more time, and back down. All right, now will you flip your arms over and close your eyes? All right, good, thank you very much. And then you can drop your arms now. And then will you squeeze my fingers? A little bit longer this time. Good. Now I'm gonna test your muscles and your legs. Will you lift your one leg up at that time? And then you can put it back down. You can lift your next leg up. Oh, sorry, that's my ankle. All right, now I'm gonna have you have a seat. I'm gonna test your feet. All right. Push down against my foot. All right, good job. And then I want you to push up against it.
I'm not really sure how to do that with my
Yeah.
foot. Okay.
Yep. All right, next foot. And then push down again. Okay. And I'm just gonna test your muscle tone under your foot. No, you're good. Usually this just kind of sit. Okay, thank you.
Do you feel anything in there?
No.
Is she a noodle arm?
You want to do one? Okay. Thank you. Alright, now I'm going to test your reflexes. First I'm going to do your bicep and both your arms.
Okay.
So I'm just going to roll your sleeve up to get a better thing. Alright. You don't have a hammer, so I'm just going to be using the end of my stethoscope.
Okay. Oh.
Okay. Alright, I'm going to give you a 2+ score for that. And then now I'm going to check your patellar reflex. Will you scoot back in the chair just so your feet are kind of dangling so they're not touching the bottom? Okay. Ready? Alright, next knee. Okay, and that was also a +2. All right, thank you so much for your time.
Yeah, thank you.